If you're over 60, you're probably very familiar with mornings like this. You open your eyes and your head feels a little heavy. Your neck is stiff. Sometimes when you stand up, you feel lightheaded and have to hold onto the bed for a few seconds just to steady yourself. You tell yourself, maybe I didn't sleep well. But deep down, you know there's another reason. Blood pressure. So many of my patients say to me, "Doctor, I take my blood pressure medication every single day. I never miss a dose. So why are my numbers still high?" Some of them sigh and add, "I even walk every day." If you're nodding right now, I want you to hear something important. You are not lazy and you are not doing anything wrong. The issue is that after 60, your body no longer responds to movement the same way it did when you were 40. Here's a scientific truth that doesn't get talked about enough. After your 50s and 60s, circulation changes quietly. Blood vessels lose some of their flexibility. Muscles gradually weaken, and most of all, the lowest part of the body, your legs, tends to be neglected the longest. When that happens, your heart has to work harder every day. Not because you're eating more salt, not necessarily because you're more stressed, but because blood doesn't return to the heart as easily as it once did. I've seen many older adults stuck in the same cycle. Higher medication doses, more worry, and then disappointment when the numbers on the monitor still don't improve. What I've wondered for years is this: why do some patients, same age, same diagnosis, same medications, have steadier blood pressure, feel lighter in their bodies, and move with more confidence? The answer isn't in the prescription. It's in how they use their bodies every day. Hello, I'm Dr. David Warren. I'm 60 years old, and for more than 30 years, I've worked mainly with older adults, people who usually want one simple thing. I just want to live normally without constantly worrying. In this video, I want to share a different approach to supporting blood pressure, one that's gentle, science-based, and designed for the body after 60. This is not about running. It's not about pushing yourself hard, and it's definitely not about stopping your medication. We're going to talk about the role of your legs, about movements that seem very small but have a big impact on your blood vessels, and how you can start right at home in just a few minutes a day. If you want to understand your body better, rather than constantly fighting blood pressure numbers, stay with me. Point 1. Why blood pressure is hard to lower. After 60, even with medication and walking, after 60, your body isn't broken. It's just working differently. When you're younger, blood vessels are flexible, muscles are strong, and blood moves down to your legs and back up to your heart with little effort. Your heart doesn't have to strain. Over time, 3 major changes happen together. Blood vessels lose elasticity, like old pipes that don't expand well. Leg muscles weaken, especially in the thighs and calves. We spend more time sitting, in cars, chairs, in front of screens. The result is this: blood flows down easily, but getting back to the heart becomes slower and harder. When the heart senses it's not getting enough blood back, it reacts instinctively. It pumps harder to keep circulation going. That's when blood pressure rises. Blood pressure medication helps relax blood vessels or reduce pumping force, and that's very important. But medication doesn't strengthen your leg muscles, and it doesn't help blood return upward from the lower body. That's the missing piece. Once people understand this, they stop blaming themselves. Many older adults think, maybe I'm not eating right. Maybe I'm not exercising enough. Maybe my body's just weak. That's not it. The real issue is that you're moving in a way that no longer fits what your body needs now. Walking is good, but for many people over 60, the pace is slow, the steps are short, the big leg muscles don't get enough stimulation. So even though you're walking, your circulation doesn't get the signal it needs to change. When people switch to movements that are controlled, targeted to the right muscles, gentle on joints and the heart, they often notice lighter legs, less dizziness when standing up more, stable blood pressure over time, and most importantly, less anxiety. At this stage, I'm not asking you to do any specific exercises yet. What matters today is remembering 3 principles. No need to push hard. Blood pressure doesn't respond well to sudden stress. Legs matter as much as the heart. Any movement that supports blood pressure after 60 must involve the legs. Less done right is better. 5 to 15 minutes done correctly is better than 45 minutes done mindlessly. In the next sections, I'll show you safe, simple movements you can do at home and why they help blood pressure naturally. Let me say this the way I say it to longtime patients. Don't fight your body, work with it. After 60, the goal is no longer training harder. The goal is keeping blood flowing smoothly, allowing blood vessels to relax, helping the body feel safe. When the body feels safe, blood pressure finally lowers its voice, and that conversation begins in your legs. Point 2. A common movement mistake that keeps blood pressure stuck after 60. One of the biggest mistakes I see in people over 60 is this: moving a lot, but not creating the right biological signal for the blood vessels. You're still walking, you're still moving, but your body never gets the message, it's time to adapt. After 60, the body becomes very energy efficient. Familiar movements, slow walking, short steps, light housework are seen by the brain as normal and safe, so they don't trigger vascular adaptation. Blood pressure only changes when blood vessels receive two key signals. Muscles are truly engaged, and the nervous system senses a need to adapt. If movement doesn't reach that threshold, blood vessels stay the same. Once people understand this, they stop blaming themselves. Many say to me, "I've been walking for years and my blood pressure is still high." That doesn't mean walking is wrong. It just means that for your current body, it's no longer specific enough. When you switch to movements that are slow, controlled, clearly felt in the muscles, the body responds differently. Heart rate feels steadier. Warmth spreads into the legs. Blood pressure becomes less erratic. And most importantly, you no longer feel like, "I exercised, but I don't know if it helped." Remember this simple rule. Good movement for blood pressure after 60 is slow, minimal, and intentional. Before any exercise, ask yourself, can I feel my leg muscles working? Is my breathing steady? Can I still talk while doing this? If the answer is yes, you're on the right track. In the next sections, I'll show you which muscle groups to wake up first, the safest order to move, and why this helps blood vessels relax instead of tighten. I often tell my patients, blood pressure doesn't like being forced, it likes being convinced. The older we get, the more the body needs gentleness paired with consistency. If you've ever pushed too hard and felt dizzy, your heart racing, or sudden fear, that was your body saying, "This isn't the right approach for me. We'll choose a different path." Slower, but smarter. Point 3, your legs, the missing piece in blood pressure control. After 60, when people talk about blood pressure, they usually think about the heart, blood vessels, or kidneys. But in reality, more than half of your blood volume sits in the lower body when you're sitting or standing. And there's a crucial factor there, your leg muscles. Muscles aren't just for movement. They're active regulators of circulation. Every time leg muscles contract properly, they apply rhythmic pressure to the blood vessels running through them. This helps blood move more efficiently, reduces pooling in the legs, sends a signal to the brain that circulation is working smoothly. When the brain receives that signal, it reduces the need to keep blood pressure high. But when leg muscles are weak and inactive, blood lingers longer in the legs, the heart compensates by increasing pressure, and blood pressure becomes harder to lower. This is physiology, not imagination. When leg muscles are activated correctly, people notice small but meaningful changes. Less heaviness in the legs by evening, less dizziness after sitting, warmer feet, easier breathing, even without changing medication. And what I love hearing most is when someone says, "Doctor, I just feel lighter." That's not in your head. That's circulation working better. At this point, you don't need to memorize exercises yet. Just remember the 3 leg areas that matter most for blood pressure. Muscles around the ankles determine how easily blood enters and leaves the feet. Thigh and hip muscles, the largest muscle group using the most energy, helping blood flow more smoothly. Calf muscles directly affect blood returning to the heart. If a movement program ignores any one of these areas, its effect on blood pressure will be limited. In the next sections, I'll guide you through a safe, logical order, so your body doesn't feel shocked and your blood vessels respond positively. I often tell my patients, don't think of this as training your legs. Think of it as helping your heart breathe easier. You don't need big muscles. You don't need heavy workouts. You just need to wake up the right areas at the right time. And when your legs start working again, your heart says thank you by lowering its voice. Point 4. Small movements that send big signals to your blood vessels. After 60, a lot of people believe that lowering blood pressure means exercising longer, exercising harder, or sweating more. But after 60, what really matters isn't how much you do. It's what kind of signal you send. Your blood vessels are wrapped in a layer of smooth muscle that's extremely sensitive. That muscle doesn't respond well to sudden, intense effort, but it responds very positively to slow movements, rhythmic motion, short holding phases, and clear relaxation afterward. When you perform small, controlled movements, your body releases natural biological messengers that help. Soften blood vessels, improve steady blood flow, gradually lower internal pressure. What's interesting is this: the brain loves stability, and when it senses that circulation is calm and smooth, it no longer feels the need to keep blood pressure high. Patients who move this way often tell me, "I'm not tired, but my body feels warmer. I'm not dizzy like I was with harder exercise. I feel comfortable afterward, not anxious." Those are very good signs. Blood pressure doesn't like being scared. It responds best to being reassured. When you move slowly with awareness, without holding your breath, without rushing, your body understands everything is under control. And when the body feels safe, blood pressure finally starts to come down. I want you to remember these 4 golden rules when moving to support blood pressure. Go slower than you think you need to. If it feels almost too slow, you're probably doing it right. Breathe steadily. Don't hold your breath. Don't tense your face or neck. Use short holds. 5 to 20 seconds is enough. No need to push longer. Fully relax afterward. Let your blood vessels rest. Let your nervous system settle. In the next section, I'll show you why these short holds have such a powerful effect on blood pressure, especially after 60. If you remember only one thing from this part, remember this: exercise to calm your body, not to challenge it. After 60, if you finish moving and feel easier breathing, warmth in your body, a steadier mood, you're on the right path. Point 5. Why gentle holding movements are especially helpful for blood pressure. After 60, there's something very interesting about the aging body. It responds more strongly to stability than to constant motion. When you perform a movement and hold it for a few seconds, your muscles create a mild, controlled pressure on the blood vessels running through them. When done correctly, this pressure isn't dangerous. It's actually helpful. While you're holding, the brain senses a slight, temporary reduction in local blood flow. The nervous system prepares to adapt. When you release, blood flows back more strongly and smoothly. Blood vessels receive the signal to relax. Overall pressure in the system begins to settle. And the key point is this: all of this happens without fast or intense movement. For adults over 60, that's a huge advantage. People who practice this style often tell me, "My legs shake a little, but I'm not exhausted. My heart doesn't feel like it's racing. When I sit down afterward, I feel relaxed." That difference matters. Pushing too hard can cause a rapid heart rate, nervous system stress, temporary spikes in blood pressure. But gentle, controlled holds help. Blood vessels relax gradually, the nervous system calms down, the body feels safe, and blood pressure is very sensitive to that sense of safety. If you want isometric style movement to support blood pressure, remember these 5 points. Don't hold until intense shaking. Light trembling is enough. Pain or strong tension means stop. Short duration, done consistently. 15 to 30 seconds for beginners. Increase only if comfortable. Breathe slowly. Longer exhales than inhales. This helps calm the nervous system, protect your joints, knees not compressed, back not rigid or strained. Rest between holds. Allow muscles and vessels to recover. In the next section, I'll help you put all of this into a simple sequence, so you know exactly where to start without feeling overwhelmed. I often tell my older patients, don't try to prove you're strong. Show your body that you're listening. When you hold a gentle position and breathe steadily, your body understands. There's no danger, no need to stay tense. And that's when blood pressure finally begins to lower. Point 6. How to spread movement through the day, so blood pressure feels easier, not exhausting. Another common mistake I see in people over 60 is this: trying to do all their movement at once. An aging body doesn't respond well to long periods of effort, even gentle effort. Your nervous system works better when movement is short, followed by rest, repeated several times a day. Physiologically, each time you move the right way, blood vessels receive a small relaxation signal. The nervous system is reminded that circulation is okay. When those small signals are repeated consistently, they add up. They're far more effective than one long session that leaves you tired or worried. Blood pressure doesn't drop because of one big workout. It drops because the body feels safe again and again. When you spread movement throughout the day, you'll notice less resistance to exercising, no need to block off long time slots, less fatigue and dizziness, better long-term consistency. Many of my patients tell me, "Doctor, this feels doable every day." And that's the key. Here's a very gentle way to organize movement. Morning light movements for the ankles and legs. Goal: wake up circulation, midday or afternoon. A few movements that activate leg muscles. Goal: keep blood flowing, prevent pooling. Evening slow movements with gentle holds. Goal: calm the nervous system and blood vessels. Each session, just 3 to 7 minutes, no changing clothes, no equipment. If you only manage once a day, that's still good. If you manage 2 or 3 times, even better. Remember this: blood pressure doesn't need you to try harder. It needs you to be more consistent. Don't turn movement into a burden. Let it become a natural part of your day. When your body knows it's being gently cared for every day, it no longer has a reason to stay tense all the time. Final reminder: before we finish, remember this important point. High blood pressure after 60 does not mean your body is out of options. Very often, it's simply waiting for you to communicate with it in a better way. We've talked about why medication and walking aren't always enough, the quiet but powerful role of your legs, why small, slow, controlled movements send the right signals, and how to organize movement so your body feels calm, not stressed. If I had to sum it all up in one sentence, it would be this: after 60, your body doesn't need to be pushed. It needs to be reassured and guided. When you gently wake up your legs, breathe steadily. Repeat this every day. You help your heart work less hard and your blood vessels relax naturally. I don't expect you to change everything tomorrow. Just start with one small movement today. Then repeat it tomorrow and the day after that. If you found this video helpful, please subscribe so I can continue sharing science-based, safe approaches designed for life after 60. And if you know someone who worries about their blood pressure, share this video with them. Sometimes the right understanding can ease a lot of fear. Finally, please remember, this video is for educational purposes only and does not replace personalized medical advice. If you have very high blood pressure, serious heart disease, or unusual symptoms, talk with your doctor before trying these strategies. Thank you for listening. I'm Dr. David Warren, and I'm honored to walk with you on the path to calmer, steadier, healthier living after 60.